know why I don't rush off for her?
Why?
Because Dr. Radhakrishnan already says. Because when I work with the main doctor on a Sunday, and it's thousands and hundreds, it's like we'll see about maybe 30 or 40 patients in a day, and it'll be just me, the receptionist, and her. And Sunday's only supposed to be for sick visits, right? The head nurse, she comes in, she complains, and she's like, well, why don't I have help? I don't have any help. You've been working with this doctor for 40 years. For 40-something years, before we ever even existed in this field, what help were you doing? What were you doing all this time? Like, she's acting like the business is different. Like, you've been doing this, like, for 40 years, lady. Like, so, and then we don't show up. She's sitting there, she's like, oh my God. So, one Sunday, Dr. Radhakrishnan came, she said, she said, because Miss Kathy was complaining, she's like, I don't want to hear it. She's like, Sabia was here on a Sunday. She's like, we saw 35 patients. She's like, and not one mistake was made. She was like, and it was just me and her. And she was like, I don't feel like she can't handle that. She's like, she's been working here for 40 years. If she's been only working here for 3. And she was like, why can't she handle that? And she was like, so I don't want to hear that complaint anymore. And she starts crying. Like a white lady. She does a white lady cry. And she's like, and then I come in, she be mad at everybody. She's like, I don't understand. I need the help. I gotta do this. And I gotta do that. I'm like, Miss Kathy, stop crying the victim. You've been here for 40 years. So when all these patients that have had their kids through here, when newborns come, of course they're requesting you. They're requesting you because you're the head nurse. Reject. You're the one with all the materials. You're the one who knows all the answers, according to them in this practice. It's a private practice, you retard. You're the same person. You've been here for 40 years. Do you really think they want us to come in there and talk to them about breastfeeding? Even though we're going to say exactly what you're going to say. Because you're the head nurse. You work under her, we work under you. Though we don't work. She doesn't want to consider it that, though. Because if something goes wrong, she wants to be like, no, I never said that. I didn't do that. No. I thought, no. She doesn't want to be responsible. Because the practice is huge. Because you got med students running in there. She has a teen program where she lets kids who are interested in being in the medical field. So you have teenagers shadowing the doctor. You have the true med students shadowing the doctor, and it's a madhouse. And then you have us doing the footwork. Everybody running through the building. Boom, 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 boom. And they looking at you. And then you got to realize all these Indian names and Shashwan and Shithrath and Siddharth. And then the doctor wants to say, Sabia. Then she gonna say to me the other day, I had to tell her. I said, listen, doc, I don't know how to pronounce half these names. Okay? So when a patient comes in, I don't know name. I know birth date, unless it's a Patel. If it's a Patel, I know name. Because Patels are by the millions in your system. I know better. And they all have the same birth date. They have the same name. Or I do patient number. We ain't going through all that. Alright, doc? Like, that's all I'm trying to tell you. So, don't think I don't know the patient just because I don't know the name when you ask. If you want, ask me dates. I give you numbers.
It's one doctor?
It's 5 doctors.
Ah, okay.
But she's the head doctor. It's her practice.
Oh, okay.
But she's older too. Doc's like 70. She's like 70. And she be in there talking about, she's strict though, but you really like that. Look, hey.
Well, doctors depend on their medical assistants.
They depend on us the most.
They don't know anything.
They don't want to give shots. They don't want
I have kind of an old oral surgeon, and I realized if she's looking at the screen and looking at my teeth and looking at the image, and the medical assistant standing right next to her and pointing to the line to read off the notes and says here's what we're going to do. So she knows, she's excellent, she knows how to do the work, but just all the theory that she has to translate to me, and she's a foreigner.
Right.
So she doesn't know how to tell me what she's going to do. So the medical assistant's right there. Kind of, it's all written out. Let's tell her this.
That's what they took. That's what
then,
she
of course,
does.
I ask questions. Now it's all confusing.
Yeah. And then she's like, and then you got us running back and forth like, Doc, she also wants to know, tell her that. Doc says, just do this. Well, I also forgot to know that. And you be like, this is bullshit. And you're like, this is bullshit. I'm not doing this again. All right, Doc, I'm going to need you to go back to room 3 because she has like 5 more questions. I have to go back to the room. I have shots to do. I can't do this. That's what I told her. She knows. She thinks I'm crazy. I know. Because I'm like their pit bull. I'm the pit bull of the building. I'm the one like, what? No, excuse me. We're not doing that. Excuse me. I didn't ask you to come in yet. That's me. I don't sugarcoat that. We're not doing that. We're not sugarcoating that. That's not happening.
You're so cute.